All right, so let's get started. I'd like to welcome everyone today to the Vasculitis Foundation webinar. I'm Kathy Olevsky, the host for the Vasculitis Foundation Educational Webinar Series. I also am a patient living with MPA vasculitis. These webinars are part of the Vasculitis Foundation's commitment to patient education, and we would like to thank our sponsors, AstraZeneca, Amgen, and Novartis, for supporting these webinars. Today's webinar is Navigating the Medication Access Process with Anna Jung. After we finish this webinar today, there will be a recorded version on the Vasculitis Foundation's YouTube channel, and everyone who's registered today will receive an email with a link to it as soon as it becomes available. And so now that all that housekeeping is done, I would like to introduce our guest for today. Anna Jung is a pharmacist and clinical pharmacy specialist at the Hospital of the University of Pennsylvania Penn Medicine Outpatient Clinic and Specialty Pharmacy Program. She graduated with a Bachelor of Science in Pharmacy and a Doctor of Pharmacy degree from the Philadelphia College of Pharmacy and Science. She has over 20 years of experience from inpatient care in the hospital setting to anticoagulation management to her present focus on autoimmune disorders, which has been for the past 10 years. She is passionate about patient education, medication access, and creating clinical initiatives that help improve the lives of her patients. So welcome, Anna. We're so happy to have you here with us today.
Thank you, Kathy. It's a pleasure to be here.
And before we get started, do you have any disclosures for us?
I do. I have one disclosure. I am on the speaker bureau for Lilly USA, but it shouldn't be relevant to today's discussion.
Okay, thank you. And now, if you'd like to share your screen, we'd love to learn from you today.
Yep. Share here. Okay. Are you able to see my screen?
Yes, that looks great.
Okay, wonderful. So I want to thank you all for joining this webinar about navigating the medication access process. Today's talk is really about how you as the patient can empower yourself on your journey to better health through an understanding of what the medication access process is. And we already talked about the disclosures. We have a full agenda, so I'm just going to dive right in. First, we're going to talk about what medication access is, the difference between brand generic and branded generics, what is a specialty medication, the difference between a biologic versus a biosimilar, the timeline of the medication approval process, insurance coverage for non-specialty and specialty medications, navigating different pharmacy options, patient support programs, updates in Medicare Part D, and then some online resources. So it's essential to understand what medication access means and what barriers can hinder one's ability to obtain necessary medications. So in a nutshell, medication access is the ability for patients to obtain prescription medications when needed. And common barriers can include the high cost, limited availability of medications, and complexities associated with navigating the insurance coverage process. And these barriers can negatively impact patient health outcomes, leading to patients not taking their medications and worsening health conditions. So this presentation aims to provide you with valuable insights and some practical resources. So what is the difference between a branded medication, a generic, versus a branded generic? So when a pharmaceutical manufacturer creates a new drug or a new medication, it is approved by the FDA and has a patent protection for a period of time so that no one but the original manufacturer is allowed to make the product. So when that period expires, manufacturers can make their own generic version of the drug. The generic medication is also approved by the FDA and has the same active ingredient and must be determined to be quote unquote bioequivalent. So some differences that can exist between brand and generic medications are that they may contain different inactive ingredients. The color, the shape, the size can be also different between generic manufacturers. So many states and health plans do require mandatory generic substitution unless you or the provider indicate that at the pharmacy level. So a branded medication is a generic of a brand medication that the generic manufacturer has decided to give a brand name to versus using a chemical name. Now, what is a specialty medication? So specialty medications are high-cost drugs, and they're used to treat complex conditions, and they often do require special storage, handling, administration. So this could be in the form of an oral pill, it could be a self-injection, or an IV formulation that you might have to receive at an infusion center, for example. So next we'll talk about the difference between a biologic versus a biosimilar. And a biologic is a drug or vaccine that's made from living cells using advanced technology. A biosimilar is also a biologic medication that is a close copy, but not an identical copy of the biologic. And this is due to the nature of the biologic drug, as it is impossible to create an identical copy. Biosimilars do go through a very rigorous process through the FDA to be approved, and they are only approved if they are as safe and effective as the originator or the brand product. So I do have a quiz here for you all. A biosimilar medication is the same as a generic medication. True or false? So I'm gonna let you have a minute to think about that, and if you want to answer in the chat, please feel free. And then Kathy, you can let me know if there are any answers in there.
I don't see any yet, but I'm going to go with oh, I do see two answers, three. Everybody's saying false.
That's correct. Yes, that is false. So biosimilars are like generic drugs in some ways because both are versions of brand name drugs, and they do have the potential to offer cost savings to patients. But the main difference is that generic drugs are generally smaller and simpler and more straightforward to copy, whereas biologics, as we already mentioned, cannot be copied exactly because they are large, complex molecules. So here in this table, I've kind of listed what the similarities and the differences are between a generic and a biosimilar medication. They're both copies of approved medications. They're both proven to be effective and safe. The biosimilar is similar to the reference product. The generic is exactly the same as the reference product. The generic is made from chemicals, and the biosimilar is made from a natural living source. So when we talk about interchangeability, this is in reference to biologic medications and biosimilars. So some, but not all biosimilars are approved as interchangeable. And this is a regulatory designation that the company has to specifically request through the FDA. And so there may be many reasons why a company may choose not to seek determination of interchangeability, such as a business reason, or because maybe the medication is administered at a hospital or outpatient clinic. And so because if it doesn't have that interchangeability designation, it does not mean that it is not as effective or safe as one that does. So depending on state law, a biosimilar has to be prescribed by name, while an interchangeable biosimilar may be substituted for the reference product at the pharmacy without the intervention of the prescriber. But again, both biosimilar and interchangeable biosimilars have to meet the same high standards for quality, and similarity to the reference product. So I just wanted to provide a quick update on some of the biosimilars that are available currently, and this may not be a complete list. Some of the Rituxan biosimilars have been on the market for several years now, and Humira biosimilars have come onto the market in the past 2 years. There's a total of 10, which is a lot. And then also the FDA has approved 3 Actemra biosimilars. And I just wanted to talk about these updates because if you are a patient on any of these medications, your insurance plan may review to mandate a switch to a biosimilar. And so you might receive a letter in the mail detailing that information. And you can discuss this with your provider. But all of these products do have patient support programs, which we'll discuss in the next few slides. So now we're going to switch gears to talk about the different insurance coverages and the terms that are used that you may or may not be familiar with. So commercial insurance is typically an employer-based or private coverage plan through the marketplace or the healthcare exchange. And then Medicare is a federal program to provide health insurance for people age 65 and older, as well as people with disabilities. Medicaid is a state-run program that is funded by a combination of state and federal dollars. And I did include uninsured as a category here. So uninsured is someone with no insurance or may be in between insurances. And I think this is important because you may be in between, employment, or maybe you have a life transition change where you're moving from one state to the other, and perhaps you'll not have insurance coverage for a specified period of time. It's important for you to discuss this with your provider if you are on a biologic or specialty medication. And this is to ensure that you don't have a lapse in therapy. There are resources available, especially through the manufacturer, that you may be able to utilize, because the last thing we would want is for someone to go into a flare because, they can't have the medication that they need. Okay, so now we're going to talk about some important terminology to be aware of when we're talking about the prior authorization process, and when we're navigating the insurance landscape. So first off, a formulary is basically a list of drugs that the insurance plan will cover, and they are usually tiered. So for example, it may be from tier 1 to tier 5, and generic medications are usually at the lowest tier, at like 1, whereas a high cost specialty or brand medication may be at the highest tier, which may be a 4 or a 5. So the tier placement dictates the copay or the coinsurance that the patient would pay. So a copay is a fixed amount that a patient pays for a product, and the coinsurance is a percentage of the product cost, which can vary in percentage depending on what your plan dictates. So in the next slide, we will go over the rest of the terms. So many of you may have encountered the situation where your doctor prescribes for you a new medication. You go to the pharmacy and the pharmacy says, well, we can't give it to you because it needs a prior authorization. And then so you go home and then you call your doctor and you're like, what do I do now? So basically a prior authorization is a requirement that you meet a certain criteria before your health plan will approve access to that particular medication. And this typically requires a form that the doctor's office has to fill out either electronically or a specific form that the plan uses for review and approval. And the requirements can include a documented diagnosis, previous therapies tried and failed, as well as clinical office notes supporting why you need this particular drug. Now, if the PA is denied, you or your physician can submit an appeal. If the physician submits an appeal, this could look like a letter of medical necessity to advocate on your behalf. But it's important to note, and I don't think many patients realize this, but all plans do have a provision where the member themselves can also advocate on their own behalf and can also appeal on their own behalf. And I've seen in a lot of cases where that has, resulted in a positive result. So the next one is a medical exception, and this is when a medication is not on formulary, but your doctor can request an exception for you when other medications on the formulary cannot be used. And that might be a case, for example, when a new drug comes to market and maybe your insurance plan has not reviewed it yet to add it to formulary, but if your doctor feels that it's necessary for you to try this medicine, they can fill out a form that's called a medical exception form and then submit that information for approval. The next one is step therapy, and this is very common for insurance plans to require a trial and failure of a drug before you are able to receive the more expensive drug. And that usually requires documentation in the charts to say, like, for example, you've tried 2 of their formulary agents before you can receive the one that perhaps your prescriber has prescribed for you. And then lastly, quantity limits sets a limit on the number of tablets or capsules that can be provided per month for each fill. But it can also refer to dosing frequency. So if you are prescribed to receive a medication more frequently than the standard dose, you may need an additional approval beyond the actual drug approval, and you may need a second approval for quantity limits. So I created this little roadmap to kind of review the timeline for the whole process in terms of the prior authorization to the end where you as a patient receive your medication. So once the decision is made by you and your prescriber to start on a new medication, the office will submit the prior authorization. Now that can vary from plan to plan, like how quickly that's reviewed. So some plans, it may be, anywhere between 10 to 15 business days. If this is something that needs to be reviewed urgently, the doctor's office can mark on the auth request that it is urgent and it needs to be expedited. Typically, when it is marked that way, the plan can review it within a 72-hour time period. So that can kind of accelerate, not having to wait as long. So once the prior auth is approved, then a few different steps may happen. The notification may be sent to the contracted specialty pharmacy that would be filling the medication, and that is usually mandated by your plan. They may have a list of specialty pharmacies that you would be required to use. So an approval would be sent to them. A prescription would be sent from your provider's office to that specialty pharmacy, and then they'll start that process. You may need to call them to set up an account if you've never used them before. They will ask you some clinical questions. They will verify your insurance. And once all that is approved, they will contact you to schedule delivery of the medication. So in between that time, if, for example, you would like to access some of the manufacturer resources, you can go online and sign up for what's known as a copay card, which I'll discuss probably in 2 more slides. But most branded medications do offer a copay support program, and that is where whatever the insurance plan would charge you to pay out of pocket, the manufacturer copay card would offset that amount, so you only have to pay a more reasonable amount of money for the copay. And lastly, once the patient receives the medication, if, for example, it's an injectable product, you may need injection training, and many manufacturers provide great resources such as a nurse that can do a virtual training with you, as well as provide sharps containers and other supplies that you may need. So here I wanted to just talk about navigating some pharmacy options. I think we're at a day and age where we have a lot more options than we used to, which is great, especially if you live in an area where you may have limited access to healthcare resources. So retail pharmacies are the traditional brick and mortar pharmacy. It's very convenient for over-the-counter products and prescription medications. They're often located in community settings. If it's privately owned, some may provide even same-day delivery services. We did already discuss specialty pharmacies, as those may be dictated by your insurance plan on which ones that you can use. So it's important to contact them and find out, so that you can maybe kind of do some homework and see if there's one that you would prefer to use versus another. Now, mail order pharmacies allow patients to receive their medication directly at home, which provides a very convenience factor. And it may also provide a cost savings if you're on a chronic medication and you receive more than a 1 month supply at a time. Digital pharmacies is something that I've seen kind of pop up more recently. So digital pharmacies are digital health platforms that combine a licensed pharmacy, which is virtual, along with telehealth services. So their operations and communication is very technology based, and you might have seen some commercials for them during the Super Bowl. So online pharmacies, I did want to mention the online pharmacy. There's PillPack by Amazon Pharmacy, as well as Mark Cuban Cost Plus Pharmacy. And his pharmacy in particular, they cut out the middleman, and that's how it's advertised to provide low-cost solutions. I don't have any affiliation with them, but I have recommended his website to a few of my patients. Now, he doesn't have every medication, but the ones he does have, it's helped to reduce costs for patients who may not have insurance, or they may have a high copay. And so it does provide another option for patients to look into. And then lastly, GoodRx. Some of you may be familiar with GoodRx, which is a healthcare company that operates a free online platform, and it helps patients to find discounts on medications. And this may, again, be another option for those who don't have insurance or may have a high copay. However, it's important to keep in mind that anything that is processed through GoodRx, if you do have an insurance plan, it will not count toward your individual deductible. So that's something that you have to take into consideration if you're thinking about using that. So I did want to talk about patient support programs that are available. We did briefly discuss commercial copay support, and this is provided by manufacturers for patients who have commercial insurance. This helps to reduce out-of-pocket costs. Patients who have Medicare, Medicaid, or TRICARE are not eligible for this, and often there is an annual cap on the amount. Copay card can be applied automatically at the pharmacy. There's multiple ways that you can sign up. The patient can sign up themselves through the manufacturer website. But if you're not familiar with that, you can also contact your provider's office, Often they have enrollment forms that they can help get you signed up for. Next is the patient assistance programs, and this is also available through the manufacturer. If a patient may be in financial need, typically uninsured or underinsured, and this is income-based, so it usually requires verification, and you do need to reapply every year. Third is foundation support. These are private foundations that have their own eligibility criteria and diseases that they cover. They may have an open period and a closed period for availability of funds. Now, the last one is bridge programs. I'm not sure if too many people may be familiar with what they are, but many manufacturers do offer this, especially for new medications. If there's a new drug that your doctor would like to prescribe for you, but for example, the insurance says that they're denying it because you haven't gone through the step therapy process. The manufacturer bridge program, also sometimes referred to as a quick start program, can help you get started on medication. So that is to prevent delay in getting you started while the provider's office completes the appeal process through the insurance plan. So they would continue to provide medication for you until the insurance approves the appeal. And the last part, we're kind of nearing the last part here. Before I go into the Medicare updates, I did want to review what Medicare is. So Medicare is health insurance for people over 65, certain people with disabilities, and patients with end-stage renal disease. So it's comprised of 4 parts, and Medicare Part A is the hospital insurance, which is also inpatient care, and it may cover services such as skilled nursing facility following a hospital stay, hospice care, and some home health care services. Part B is the medical service, such as doctor's offices, outpatient care, preventative service, as well as home health care services. Part C, we're not going to really talk about today, but it's also known as Medicare Advantage Plan. It's a type of plan that is offered by private insurance companies that are approved by Medicare, and it's pretty much like a bundled service that can combine Part A, B, and sometimes Part D. So the last part is really what we're focusing on. Medicare Part D is the prescription drug coverage part of Medicare, and this helps to cover the cost of prescription medications. Part D plans are offered by private insurance companies and approved by Medicare, and which drugs are covered, deductibles, copays, and premiums vary based on the plan. So the enrollment period for Medicare, if you're new to Medicare, is a 7-month period that begins 3 months before a person turns 65, their birthday month, and then ends 3 months after the person turns 65. Coverage begins the month after a person enrolls during their initial enrollment period. If you are already in Medicare and you would like to make a change or switch to a different plan, the open enrollment period for 2026 is between October 15th to October 7th, 2025. So this is the really exciting part that I want to highlight. What's new in Medicare Part D as part of the Inflation Reduction Act from the Biden administration, which is in effect as of January 1st of this year. So in the past, there used to be 4 phases of coverage, but now it's been changed so that there's only 3 phases of coverage. So the donut hole is gone, which is also known as the coverage gap, and this translates into an annual out-of-pocket cap of $2,000 for prescription medications. So this includes all medications, including specialty medications, that are covered by Part D plans that are included in this cap. So it's important to note that it has to be a medication that's covered by your plan. If it's not a medication that's covered by your plan, you will still be responsible for the full cost of the medication. So it's important for you to verify that with your individual plan. And it does not apply to drugs that may be covered under Medicare Part B, such as injectables or infused drugs that you may receive through the infusion center or a hospital setting. And it does not apply to your monthly Part D plan premiums. So the third thing that is new about Medicare Part D is the Medicare prescription payment plan. And this is a new option that is completely voluntary. So once you hit that $2,000 out-of-pocket cap, Medicare gives you the option to pay that amount spread out over a 12-month period. So if you are not able or do not want to pay that amount all at once, you can opt into a payment plan. But one thing to note is that you have to contact your plan and let them know that you do want to opt into that. Otherwise, you won't pay anything at the pharmacy when you get your medication filled, but the insurance plan will send you a bill for the total amount if you do not opt into this plan. So that's just an important thing to remember. And then lastly, I just wanted to mention some online tools and resources. The Purple Book through the FDA is a database that contains information about all FDA licensed biologic products, including licensed biosimilars, interchangeable products, and the reference products. And this is available for the public as well as healthcare providers. And it provides information if you have any questions about the products that you may be taking. Second is the FDA.gov Biosimilars website. And this contains fact sheets about what biosimilars are and how they're approved through the FDA. Third is Medicare.gov, and this is the official site for all things Medicare. It does offer different tools and features so that you can compare options for Medicare coverage, see what plans are in your area. And I do believe that it does have a calculator to help you determine what your potential costs would be. And that is also related to the shiphelp.org website, and that stands for State Health Insurance Assistance Program. So you can get free personalized health insurance counseling about Medicare, and this is unbiased. They aren't connected to any insurance companies or plans. This is SHIP staff are trained volunteers, and they work to basically answer your questions that you may have about Medicare. And lastly, the PAN Foundation stands for Patient Access Network, and this is a nonprofit organization that works to provide grants and funds to eligible patients through financial advocacy. So they offer grants for over 80 disease states, for rare diseases and cancers, and each grant is for a 12-month period. Any grant, there is an open and closed period where funds may be available or they may have been allocated. So if that's something you want to look into, you can contact their organization for more information. And I know that was a lot, so that's all I have for today. If anyone has any questions, I'd be happy to answer them.
Well, thank you, Anna. We do have one or two questions that I've seen. If you want to stop sharing, then we can see you in a larger screen. Great. I think one of the first questions is, I found the prior authorization process to be long and complicated and frustrating. Sometimes I've waited more than 3 weeks for authorization for a drug that I need. Do you have any suggestions or ideas on how to get that answer sooner?
Yes. So I think it's very important to be in communication with your physician's office. Often there is a point of contact who would be the person who is submitting the prior authorization, who is checking on the status of the authorization. And it can vary from doctor's office. For example, in our clinic, that person would not necessarily be me, but I know that patients can contact me and then I can contact our staff to see, where things are in that process. So it's important to be able to get to the right person, and they can kind of help you navigate the next step. But I would say always contact your doctor's office first so that somebody can check into it for you, because they have a lot that they're juggling as well. And but if you don't kind of advocate for yourself, it's not that somebody doesn't want to help you, but sometimes the office does gets overwhelmed too. So they
Right.
need kind of like a nudge to let them know that you need some help at that time. So
Right. And there's a question in the question box that if it's not, you just tell me if it's not in your field, but he says, I had a fairly severe reaction to an infusion of rituximab, after having only limited issues with prior infusions of Ruxience. This was an insurance switch issue. My doctor then got authorization for Ruxience, which worked without any issues. Is it common to react differently like this?
that's a really great question. Um, So, because of the nature of biologic medications, and each patient response um, can be varied. So, based on the data that we have, um, we don't know what reaction that each individual patient may have. Although that is very interesting because usually patients tell us the opposite, which is that,
Mhm.
they were doing well on the branded product and then they switched to a biosimilar and maybe they had a different reaction. Um, but I don't think that speaks to the efficacy or the safety. It's just because of the nature of the medication that we're dealing with, we don't always know what kind of reaction each individual will experience.
Yeah, and I was going to say, in some of the social media groups that I participate in as a patient, where I try and refer them to help to the Vasculitis Foundation or something, that a lot of people say they don't have any problem with biosimilars. So it probably is a very individual basis, and you just have to communicate with your physician, I would imagine.
Yes,
Okay,
absolutely. Hmm.
thank you for answering in that one. This person simply says, my medication has been denied. What do I do now? There was a lot in your presentation, but maybe just like point them in a quick direction, maybe.
Right. So, if your medication is denied, your insurance plan should notify you, and that is typically through a letter that you would receive in the mail. And that usually outlines the reason for denial, what was denied, but also a copy would be sent to your provider's office. So I would recommend to contact your provider's office, because a lot of times it comes through snail mail and it might be, a few days before they're actually like notified of the denial. That way they can look into it and then see what the next steps are. Typically in the denial letter, it will outline if there is an option for an appeal or if the doctor can do a peer-to-peer. So a peer-to-peer is when the physician can call a specific number that's outlined in the letter and they can speak to a medical provider that works at the insurance company, to discuss the particular case and see if they can get it approved by direct communication. So having that information, I think, is important to determine what the next steps might be.
Okay, great. And another question, you did talk a little bit about copay cards, but this person says, can you explain again what is meant by a manufacturer copay card? But specifically, how do I get one? And do you have to reapply each time you get the medicine?
So my understanding is that once you apply, you don't have to reapply because you are assigned a specific card number. But going back to your initial question, there's multiple ways to sign up for a copay card. Number one, you as the patient can go onto the manufacturer website of that particular medication. There should be a link that goes directly toward copay support. Typically, if you're on the website, there might be a lot of tabs, but it should usually be titled resources. You can click on that. It will ask you very few questions like your name and your diagnosis, and then you can sign up for it. Some companies will send you an actual physical card in the mail, which you can take to the pharmacy, and then they can apply that directly at the pharmacy level. Or if you're in communication with your specialty pharmacy, you can give that to the representative over the phone. But a lot of manufacturers do provide a virtual card that may be sent through your email. And then doctors' offices, I think I mentioned before, they do have enrollment forms in the office so that if you are at an office visit and you do decide that you are going to start a new medication, that form can be completed. Typically, it does require a patient signature because this is a program that patients have to opt into. So if you fill out the form and sign it at the visit, they can fax that over, and then they'll process that and then contact you.
Okay, great. Gosh, thanks. That was great information. A lot of times patients just have no idea where to start, and I really appreciate that you gave us some steps for those things. So thank you so much for that. I am at this point, I just want to share something else with the I can get my screen up here. Oops, I just lost it. Of course, that's how it always works. We wanted to just say thank you very much to you, Anna, for spending your time with us today. And also, I want to just note that a lot of times patients ask us about how they can help with research and things for vasculitis. And one of the things you can do is participate in something called VPPRN, or Vasculitis Patient Powered Research Network. And it's so simple. You just, like twice a year, you fill out a form, answer some questions, takes me about 10 minutes twice a year. And then your data-driven research will help us moving forward and will help researchers. There's so many great young doctors working in the research field now, and they need this kind of data to move forward with their research. So I encourage you to learn more by going to vpprn.org and just learn about completing these forms twice a year to help with that research. So I wanted to start by saying that, and then just after that, just to say thank you so much, Anna, for spending your time with us and answering our questions today and that great presentation. And thank you to the Vasculitis Foundation for providing these informational webinars for us. And our sponsors, of course, Amgen, AstraZeneca, and Novartis. And thank you so much, Anna.
Thank you so much for having me, Kathy. It was a pleasure.